Welcome to Chapter 2 Dental Caries. These are the topics that we will be covering today. Before we delve into the details, what is tooth decay? Also known as dental caries, it is the breakdown of teeth due to bacterial action forming cavities. Tooth decay can present itself at an early stage as white spot lesions where teeth will appear chalky white, usually along the gum margins. It can progress to moderate stages where there are large areas of obvious tooth decay which can be unsightly. In severe stages, tooth decay can result in extensive tooth destruction. So, what causes tooth decay? Tooth decay mainly involves the interplay of four factors: presence of tooth structure, presence of bacteria in the mouth, one's diet, and finally, time for the progression of tooth decay. But how do these factors cause tooth decay? Step 1. Bacteria consume sugar on teeth and form acids. These acids dissolve tooth structure. Over time, progression leads to tooth decay. So that's how these factors are contributing to tooth decay. Can tooth decay be transmitted to children? Yes, it can. Oh no, but how? Mothers can spread the bacteria of tooth decay to their child through the sharing of food or cutlery and utensils. Caregivers with a high amount of bacteria will put them at a high risk of infecting their child. Transmission rates are 24 to 100%. Secondly, spread of bacteria of tooth decay can occur between children and their peers through shared food and objects. In the United States, transmission rates are 6.3 to 13%. What happens when tooth decay is left untreated? Persistent infection. Spread of infection from primary teeth can cause tooth decay in permanent teeth although they have not yet erupted. Secondly, pain and swelling. This puts the child in misery and suffering. Thirdly, tooth loss. Having less or no teeth to eat compromises on nutrition and affects the growth of the child. Also, the bad breath and unsightly appearance lowers the self-esteem of the child. So how do we go about preventing tooth decay? Oral hygiene practices, diet advice, usage of fluorides such as toothpaste, all of which will be covered in the subsequent videos, and lastly, fissure sealants. To summarize, tooth decay is the breakdown of teeth due to bacterial activities and it involves four factors. Bacteria consume sugar forming acids which dissolves tooth structure and over time leads to tooth decay. It can be transmitted from mother to child or between children. Left untreated, it affects overall well-being of the child. Therefore, prevention is important to limit its progression. These are the references. See you next time! In Chapter 3, Gum Disease and Toothbrushing.
Created using Powtoon.